Malaria is the #1 killer in most sub-Saharan countries, and Ghana is no exception. Every 45 minutes, a child dies of malaria in Ghana. Once upon a time in Obuasi, the situation was no different. Mine workers were spending more time in hospitals than at their posts of duty. Out of a workforce of 8,000, there were nearly 6,000 recorded cases of malaria each month. So in 2005, AngloGold Ashanti decided to actively fight malaria in Obuasi. This is what birthed the AngloGold Malaria Control Program.
Object of it was to make a difference, and it's utilizing an integrated malaria control program, utilizing all interventions available to us to use as tools in the fight against malaria. It was also incorporates the community around the mine.
The mainstay of this integrated intervention is the Indoor Residual Spraying (IRS) program. A well thought through and carefully implemented program, it didn't take long for the effects of the IRS intervention to be felt in Obuasi. Within a short time, the results were there for all to see. Cases for people with malaria kept dropping significantly. As of December 2012, there had been drastic reduction of the number of malaria cases in Obuasi by a whopping 76%. Owing to the unquestionable success of the program in Obuasi, AngloGold decided to extend the program to other communities with focus on malaria endemic areas in the country.
AngloGold started first in Obuasi. The results obtained was very favorable. So as a program, we helped and supported AngloGold to submit a proposal to Global Fund. So globally, I'll say AngloGold Ashanti is the first private company to benefit from the Global Fund.
AngloGold did apply. But before then, AngloGold had made a very compelling case. Compelling in the sense that when they were doing their Obuasi program, they were able to reduce, which was significant, by 75% the number of malaria cases within a span of about 4 spray cycles. So it was significant and compelling. And therefore, when the opportunity came for us as a country to nominate civil society and private sector organizations, we did. They ran through the process. The process is very exhaustive, and they were able to get a tick for all the things that we were looking for.
We're currently operating in 5 regions. We spray in the entire Upper West region. We've almost covered Upper East region. Then we're operating in 4 districts in the Western region, 2 districts in the Central region, another 4 districts in the Ashanti region. We start spraying Northern region at the beginning of 2014. So by the end of 2015, we would have sprayed a total of 48 districts in these 5 regions.
The municipal and district health and administrative officers in the various communities with Agamal presence deserve special commendation.
And we did the initial entomological studies to know which mosquitoes we have here, and for that, which chemicals can be effective against those mosquitoes. We were deeply involved from that stage.
The collaboration between Agamal and the Ghana Health Service in this region is probably the best in my view, because right from the word go, from the conceptualization stage, we were involved. I remember we were called to Accra, where the idea was muted and discussed with us as regional directors, and we all bought into it.
I will first of all say that the collaboration between us and Agamal has been a very effective one. Right from the inception of the program, the health sector was a key organization that was involved.
Encouragingly, the success realized in Obuasi has been replicated in several other districts.
Economically, If mothers used to remain in the house because of their sick children, and now the children are healthy, when it is morning, the children will get up, wash themselves and go. They don't wait for them again as used to happen.
Bangwa eman die awachura nulanga. Ni jabele yiti jenga aga asabetaka malaria la. Kabla vyankar enga mapa.
First time tire your pam number near tire your pa. Obe spray them one the minya malaria. Remember go school on say one finding the fear when malaria. They doing do fine. And the man kada banana bibi dem spray with them wakata was spray I mean even them in zamani na mfambra pado na mbubu ntokwa dem under home for 2 hours. Mbo we dey more down. Can na pray. Yako dem wo bibi very nice.
Fat wa gwan bebre. Wa ma sisi a meda from pa mama come on.
Clearly, this is a project that demands all the support it can possibly get.
I take great pride in the work that we do because I think, frankly, it is very exemplary. And I want to comment both the corporation but also the staff that manage the program on a day-to-day basis and of course the donors that make it possible for us and the host country. I think, frankly, it's as a flagship program, it's probably one of the best I've seen in the sector.
Taking it forward, we will still need to keep partnering, and we would, definitely want to stretch our hands to people who want to make a difference in addressing the big issues that confront our country and the continent at large.
Our vision is on course to save lives. The evidence is there for all to see. No wonder Ghana says, thank you, AngloGold.
I want to say a very big, warm thank you to AngloGold.
Thank you, AngloGold.
Thank you very much, AngloGold.
Kudos AngloGold.
Thank you, AngloGold.
Baraka AngloGold.